Hey listeners, this Black Friday, transform your health and wealth with our exclusive Black Friday bundle. Limited time, big impact. Don't miss out. Your breakthrough starts now. Welcome to Nurses with Voices. I'm Dr. Lindra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduce stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started. Welcome back to another episode of Nurses with Voices. I'm Dr. Lindra, and today I have Rosa Hart here. Rosa is a stroke nurse navigator and an award-winning podcast host of the Stronger After Stroke, produced by the Norton Neuroscience Institute. I can go on and on about Rosa because I'm so impressed with her journey, but I want her to share more about her journey with you. So Rosa, please go ahead and introduce yourself to the listeners. Let them know about your journey into nursing and into being this award-winning podcast nurse that you are.
Well, thank you, Lindra, and I really appreciate you inviting me to be on Nurses with Voices. It is so important that we use our voices as nurses to advocate for ourselves as well as our patients and our communities. And so, I have been in healthcare since 2013. I started as a nurse aide when I was going through nursing school, and I thought I wanted to be a flight nurse, and then I did a shadowing day and decided that was not it. But I started working in the ICU with stroke patients, and I saw some really miraculous recoveries, and that really inspired me to be really passionate about taking care of stroke patients. But it was also really hard because you were seeing people on the hardest days of their lives, and there are a lot of times strokes do end tragically. And that was really hard on my heart too. So in 2020, I actually transitioned to the role of stroke nurse navigator for Norton Healthcare. And doing that, I get to call people after they go home from having a stroke and talk to them about their modifiable disease risk factors like blood pressure, cholesterol, blood sugar, let's stop smoking, all that fun stuff that people totally want to hear about. But we also got to have some really good other follow-up questions about how to deal with the anxiety and depression that comes after stroke. And I got to lead a support group here at the Norton Neuroscience Resource Center that helped to inform my understanding of what people need long-term afterwards. And so through that, I got to see the needs, and I got to hear what was not being met. And after I had been in my off time adventuring and creating another podcast that was all about celebrating how wonderful Louisville, Kentucky is and how much you should need to come visit because we have an incredible food scene, by the way. So I learned podcasting through that. And so I was invited to make the stroke podcast because I was somebody who knew how to make a podcast, basically. And they were like, well, you know what your patients need, so how about you develop the content? And so I did, and selected who we were going to interview. So we've got experts talking about rehabilitation and how to prevent strokes from an expert point of view. And then we also have stroke survivor stories where they're sharing what was helpful for them in their recovery after stroke. And the award you mentioned, not proud of that at all. I'm just kidding. I'm very proud of that. At the International Stroke Conference at the American Heart Association put on in February, it won first place in the Get With the Guidelines poster presentation. And awesome. So it was listed as the #1 takeaway from the International Stroke Conference this year because it's a free gift to the world.
So I think I shared this with you. One of my first jobs was as a neuroscience nurse. So we actually were the Neuroscience Center of New Jersey,
And we trained in neuro ICU, neuro step down, because this was all new. So it was all new. And I worked in neuro for about 10 years, like the first 10 years of my career. I mean, I worked in other places as well, in other areas of nursing within that 10 years. But for the first at least strong 5, it was all about neuro, like just neuro, like I said, floating back and forth. And to your point, we see that tough side. And a friend of mine, a really good friend of mine, she had oversight. She worked in outpatient. So she gets to see the patients when they come back after they've had their rehab. And that piece of it fills my heart, right? To be able to see that person who they couldn't talk or they couldn't walk, and being able to gain those strengths back is just absolutely amazing. It really, really, really is. So kudos
we
to
do
you.
it.
Absolutely, absolutely. And it's important to be able to see the after, because we don't get a chance to see that in nursing. And I think that what sometimes leads to some of our sadness, right? When we talk about what we go through mentally, but to be able to see that side is absolutely amazing. So how is that podcast going? Do you actually do you speak as well, right? Do you go to different conferences and speak about
I do.
neuro? You want to talk a little bit about that?
So the Stronger After Stroke podcast comes out monthly. We release a new episode on the first Monday of each month. And so our latest episode that just came out is on cognitive rehab with a speech therapist. And she's talking about what speech therapists do for cognitive rehab, because they don't just help people pronounce words or swallow better. They actually do a lot of like mental rehab as well. And so that's something I really wanted to highlight, because that's not something most even nurses understand. And so just a kind of shining a light on the interdisciplinary team and the roles that they play is something that I try to do on the podcast. So you can subscribe on all those different audio channels, but also I have the videos on YouTube as well. So that's available visibly. That has kind of set things into a new trajectory. You mentioned I've been able to speak at some conferences because as a result of the visible presence of the podcast, I would think people are more aware of it, even if they don't really listen to audio podcasts. And so I would just presented at the American Association for Neuroscience Nurses annual stroke conference in Houston. And the title of my talk was Innovations in Transitions of Care for Stroke Patients Using Podcasts for Patient Education. And that was so meaningful to me because I have been going to the conferences for AANN for years. I've been a member. That's where I got my certification in stroke care, the SCRN, through them. And as I was attending these conferences, my boss put it in my head. She was like, I want you to speak at these conferences one day. And I was like, well, what would I even have to say? So I just listened to what other people were saying outside of the actual talks. And there was so much talk about the frustrations with transitions of care, because a lot of the focus of the sessions has always been on the acute care and getting door to needle times and length of stay stuff improved. But then after they leave the hospital, it's like they just fall off the map and they're like, what do we do with these people? And so I really wanted to address that because that was something that I was hearing was a need. And there was lots of room for innovation.
Power Up Nursing. Did you want to talk a little bit about Power Up Nursing?
Sure.
You're the advisory board chair?
Yeah. Yeah. So that just kind of came out of left field too, in that being on different people's podcasts, talking about the stroke podcast as something to use for helping patients and providing that education gave me an opportunity to use my voice as a nurse, as a leader, even though I don't technically have a leadership title in my role. Just nurse navigator, which is not actually esteemed to be a leadership role, but in general, any so much as all nurses are leaders. So just like through meeting more people, I was invited to speak about using podcasts, especially nurse-led podcasts, to elevate the profession and to establish nursing as We are authorities in healthcare. We can speak as experts to community health issues. I'm doing that with stroke, but as nurses, we all have different areas of expertise, and we can all participate. If for your example, you're doing the Nurses with Voices podcast, and so you have your target audience. Maybe somebody else has expertise in epilepsy, and they can make one for epilepsy. There's room for everybody. It's not a contest.
There is.
So I really want to be able to empower other nurses to use their expertise and not feel like we have to wait on someone else who knows better. There's always going to be somebody who knows better, but are they going to open their mouth? Or are they going to have other things to do? Or are they going to have imposter syndrome and not feel equipped to put their voice out there? So I love that you're encouraging people to use their voices, because if we just always wait on the next degree or something to validate what we have to say, we may never get anywhere. So one thing that I really wanted to emphasize in my first presentation for Power Up Nursing, the Power Up Nursing Cruise, which was an international speaking engagement I got to go on. Crazy. It was wonderful. That's one thing I really wanted to emphasize was, if you can educate your patient at the bedside, that's the level of expertise you need. You don't need anything else to put it out there in public, be on TV, be on the radio or on a podcast, and just get that messaging out there. If it's valid enough to share with the patient, then you know it's valid enough. You can share it more publicly as well.
Absolutely. Absolutely. I love that. And I think that's such an amazing idea. To your point, there are actually lots of podcasts, and there could be more, and there are resources for everyone. So there's resources. There's a podcast that talk about nurses of faith. There's podcasts that talk about IV hydration businesses. There's podcasts that talk about legal nurse consulting. So there's so many podcasts. And to your point, like, that's the beauty of podcasts. And that's why I like this area. It's one of those areas that people are starting to tap into it. When I see nurses with podcasts, it just like warms my heart. I'm just like, yes, because it's nurses, using their voices, right, to have an impact on their communities, on the nation, because with a podcast, you're not only able to affect your organization, but you can affect nationwide or even internationally. You have, platforms like Apple, right, Amazon Music, Spotify. These platforms, they reach worldwide. So that's the beauty of having a podcast. And I thank you for sharing that. I do want to ask you one question. I have to ask you this. I think you might know what I'm going to ask you. So I was asked, what would I do if I had $1 billion grant?
Oh my goodness, you are turning this around on me. I didn't know you were going to ask me that.
So tell me, what would you do with your grant?
Okay, well, prefacing this, I asked you first. On the first Rosa's Insights podcast, I got to interview Dr. Lindra. So if you want to hear her answer to this question about what she would do with $1 billion, does it have to be for healthcare in your context, Dr. Lindra?
You know what? You go for it. No, it doesn't have to be for healthcare.
I think I would like to invest in making sure that there is childcare available for parents who have jobs and need to go to work, because that holds so many people back. And this is very personal for me, because when I got my first degree in singing, and then I decided I didn't want to be a starving artist. So I decided to go to nursing school. But in order to go to nursing school, I didn't have any scholarships or anything. And I was able to work as a server in a restaurant and pay the tuition, because tuition was way cheaper just, 10 years ago. And I could afford the tuition. But the cost of daycare for my son to just go to daycare while I was in nursing school cost double the cost of tuition at a community college. Okay. Cause I got an ADN to start with.
Right.
I had to take out a student loan to cover the childcare cost alone. And that could have been, that could have kept me from going to nursing school. That could have kept me from ever becoming a nurse if we were not able to get that student loan for whatever reason, and my life trajectory would be so different. And then I wouldn't have been able to have all these experiences with stroke or podcasting and then be able to give this gift of the Stronger After Stroke podcast to the world, right? So really just we dial it back to kind of like the origin story, if I had, easier access to childcare, we didn't have any family around to watch my son. And it was kind of scary leaving him with people that I didn't know and just hoping he wouldn't be sick every day. And then I get kicked out of nursing school because of absences due to the germs you pick up at daycare. It was a miracle, right? It was a miracle everything worked out. But childcare can be just such a huge barrier to families being able to survive, let alone thrive and grow in their careers. So if that's something I could find a good solution for, I think $1 billion investment in creating sustainable sources of childcare and making sure those childcare workers were protected and trained appropriately and supported so they want to stay. Because one big thing about the childcare workforce as well as the nursing care workforce is retention. We need to retain good talent, and we can do that by paying them appropriately and providing them with support so that they feel like as valued as they really are to society.
I love that answer, and you're right. Childcare, when you talk about going back to the origin, I think it's really important, and I love that you advocate for that. I can remember during COVID when they were closing schools and parents were forced to stay home, and people couldn't come to work because they had no one to take care of their kids. A lot of them, they wanted to be there, right? They wanted to be on the front lines and they couldn't. Healthcare was a huge issue with people being out of work. So I actually do love that answer. And, I want to give an addendum to my answer as well.
So good one on the Nurse Roses Insights podcast later. What's your addendum?
Because it's interesting that you brought up that, you brought up the tuition, right? Because when I was thinking about it, I was like, I forgot to mention tuition reimbursement. I know we talked about my answer on your podcast, which I'm going to send everyone over to your podcast, but I forgot to mention tuition reimbursement, and not student loan forgiveness is what I mean. Student loan forgiveness for healthcare workers. Now, I know that there are different grants, the SAVE, and politically there's back and forth with student loan forgiveness, but I think this is something that really should be, this way it won't be an issue with people going to school who want to really get into the world of healthcare, but they just can't afford it. So please tell everyone where they can find you. I thank you so much for coming on and blessing our podcast with your presence. It's been such a pleasure.
Blessing, Lindra. Come on. Thank you for having me. You can find me on social media at Nurse Rosa Speaks. I'm on LinkedIn. Feel free to connect with me professionally there. You can also find the Stronger After Stroke podcast, as we said, on all those different audio platforms and YouTube. And then the latest newly released podcast featuring the one and only Dr. Lindra is Nurse Rosa's Insights, which is on the Health Podcast Network. And we'll have episodes on video on YouTube as well.
Great. Well, thank you again. All right, everyone. So until next time, make sure you stay inspired, stay empowered, and stay educated.